It's great to see you all here today, so thank you for joining. That's brilliant. And I just wanted to say at the beginning that this webinar today is primarily aimed at UK families. We've organised this with STEPS charity worldwide who support families in the UK, and also 2 brilliant UK clinicians. So we're going to focus on UK situation at the moment, but we will try and provide some opportunities for more international discussions in the future, and that will be coming soon. But for today, we'll pick the most relevant. So I think we should probably all introduce ourselves before we start. Loredana, do you want to introduce yourself?
Yeah, sure. Hello, everybody. I'm Loredana from STEPS Charity Worldwide, and I'm the Managing Director. Thank you all to attend today's webinar. I'd like to thank Denise and Naomi and Rose for their time, especially during COVID-19 pandemic. So thank you very much for your precious time. Much appreciated.
Great, thank you, Loredana. So Loredana is the Managing Director of STEPS Charity. So great to have you on the call. Naomi?
Hi, some of you know me. I'm Naomi Davis. I run the Post-tenotomy practice up in Royal Manchester Children's Hospital. And I've been doing it a while. I think it's about 19 years now. What we're hoping today is that we share our experience for family questions today, just to advise. I see some very clinical questions coming in. There will be advice coming out from that through the BOA and the British Society of Children's Orthopaedic Surgery, and we'll try and touch on it later if we've dealt with all the family questions.
Great, thank you. Denise?
Hi, I'm Denise Watson. I am a physiotherapist working at Chelsea and Westminster Hospital in London. Like Naomi, several years of experience in treating clubfoot, and yeah, looking forward to hopefully reassuring and sort of settling some anxieties about what's going to happen during this rather unusual period.
Brilliant, thank you, Denise. And I'm Rosalind Owen. I'm the Executive Director of Global Clubfoot Initiative, and you're all really welcome. Great to see you on the call. So Naomi, I'll hand over to you to just introduce the session, and then I think we'll go quite quickly to questions.
Lovely, thank you. Thank you, Ros. So we're here specifically because we wanted to try and allay some of the fears that we know families have around their children's treatment for clubfoot. In a way, it's fortunate clubfoot isn't urgent, but I know that we feel some of the work that we do is important, and some of the family problems are important and urgent. But in the face of what we have at the moment, many of you will be aware that some of our services are having to step down. I think some of the background to this is that most of us started our treatment and our clinics on children who were waiting for surgery. So we started treatment for babies that were 9, 10, sometimes up to a year old. So we all have some experience of that and know that we can get very good results from that. And that internationally, the standard really, although we'd like every baby treated sort of 2 to 6 weeks of life, in fact, internationally, that's not what happens at all. But there's extremely good evidence from our colleagues overseas that that treatment is just as effective. So yes, we all have practices at the moment that try and capture babies early on, and there are definite advantages to that. But in fact, we know that the results can be as good if we need to start later. And I think that's the situation we're going to find ourselves in. I'm very aware that we're very much, certainly in Manchester, I think London have it differently, in a planning phase for what is sweeping through. And I think quickly in the next week or two, we'll find ourselves in the middle of it with some very different priorities. And we absolutely want to be able to treat all babies with clubfoot. That's a standard of ours. But today is really about trying to allay some of the fears that people will have about that being later than we'd normally expect in the UK. Loredana, are you okay now to go on to some questions?
Yeah, sure. So we have categorized some of the key questions we have received via emails, and For those of you that have sent the question, thank you very much. Please be aware that we're conscious today is only 30 minutes, but we're going to organize another webinar, hopefully next week. So if we do not cover your questions now, please rest assured that we will do so either later on, or you can send an email to us at info@steps-charity.org.uk. So the first question is the following: if my child just started a casting phase, will this continue as per the Ponseti treatment? If not, what are the long-term consequences of not changing the cast on a timely manner?
Okay, so I think everyone's situation is different. Every hospital situation is different. In Manchester, we're not starting any new treatments, but we are completing the ones that we've started at the moment. Casting will continue if it can. There are queries as to how the tenotomy will be done. Some people do the tenotomy in clinic, some people do it in theatre. There are theatre pressures, and so individual practitioners will be needing to consider how best they can manage that. As you know, around about 90% of babies will need a tenotomy. Our advice is that if you can do the tenotomy, do it, and then the boots and bars must be seen as a priority after that. So that would go on our list of urgent things that need to be done and completed in outpatients. If the tenotomy can't be done, then stopping casting, taking a break, and knowing that we can come back to that treatment later, sometimes with an advantage from those previous casts, and you're still going to get a good outcome at the end of that, I think is important.
The other question is, if we continue with casting and suddenly something happens, so my baby's hurting, or I no longer can see the toes, what do I need to do if I cannot reach my consultant? Do I go to A&E? So
again, every hospital has a different setup, but most plasters will come off with soaking. So if for any reason you can't get to A&E, and that's because the A&E is incredibly busy, or because you don't want to put yourself in that situation by going into a hospital where potentially you raise your contact, that you can soak that off in the bath, and the plaster will soak eventually. So warm water in the bath, slightly wrinkly baby, keep massaging that plaster as it softens, breaking it down to allow the water to get through into the different layers, and eventually you'll be able to get that off. It'll take time and patience, but you can take that plaster off yourself.
Naomi, just to come in there, the other thing that it's possible to do is to actually wrap some wet towels around the leg, and then cling film around that over the top of the cast, and that will start softening the cast, and then you don't get a completely wrinkly baby, you just get a wrinkly
yeah, a partially wrinkly
and
baby.
it might reduce the amount of time that the baby actually spends in the bath. But I'd agree with Naomi that all casts can eventually, all plaster of Paris casts can be soaked off, and I think attending, certainly from a London point of view, attending A&E at the moment is absolutely not the right thing to do with a small baby. There should be contact numbers for the teams that are treating, and I think that's really important for local teams to have a good contact link so that you're not attending A&E. We've just had one baby who was in mid-casting, whose family are now COVID positive, and so I phoned and spoke to his mum about taking the cast off at home, and then we will wait until things settle down, and we're able to see outpatients again, and we'll start again.
And we're used to, just to reiterate, we're used to having cast holidays for some of the feet that are more difficult to treat. We regularly do cast holidays and then come back and start again. And again, often with some benefit from the previous casting, but still with good continued treatment and outcomes. The other thing to say is I had one of my patients years ago when they lived a long way away and they needed to get the plaster off, and I don't know, I'm not saying go out and buy them, but toenail clippers that are round-ended, dog toenail clippers or cat are round-ended, can also be used to snip away at the cast quite safely. People will find their ways to get these plasters off.
Thank you, Naomi and Denise. Moving on to when a child is in boots and bar, one of the questions that is quite common now is, will I be able to get a new pair once they are too small? And this is due to the fact that they're aware of the fact some clinics are now closed. So will the boots be posted to them? Do they need to go into the hospital to get a new pair?
I think there's a number of different things. Number one, what we think of as too small is often still okay. So there are many places that let the toes come over the edge of the boots, and there's no problem with that. Don't worry too much if it's just that the toes are just eking over the edge of the boot a little bit. But yes, there are arrangements in place. I know some of our companies, Supro, have said they will send out boots to people that need them. These requests need to come through the hospital teams so that we can work through that. But also we need to have permission to give out your address details to another company. So if you're not happy for that, you need to let us know. I think some hospitals are arranging some sort of drive-by boot grabbing events. I'm not quite sure how those are working, but in general, the best advice is to get in touch with your hospital team. We'll all be arranging something. And a lot of us are trying to arrange video calls, telephone calls and video calls to be able to keep in touch with you and for you to have the sort of contact you'd normally have. And I think we'll be surprised how well that works and how we can stop you having to travel and into, hospitals in city centres and park and stuff like that. And I think we might find in the future that that works a lot better for people.
Thank you. We also have received a question which is quite key in terms of starting the treatment. So question is, has just been my 20-week scan, being diagnosed with a child with talipes. They'd like to understand what type of assessment are they going to go through, if any.
So they've just been diagnosed at the 20-week scan?
Yes, and so they would like to understand if there's going to be a treatment or if this is going to be delayed.
Again, I think it's difficult to know at this stage. I would guess that things are going to be delayed. And there's little we can do about that. But as I said, I think it's understanding that some delay isn't going to be an ongoing problem and will still lead to a good outcome when treatment comes to you.
I think I'd say also the plan will be, certainly at the moment, is that we'll do video or telephone consultations for all prenatal
so
that we're actually able to talk through with the parents and sort of keep them as informed as possible and have an email so that we can keep them up to date on what's happening. And it's just changing from week to week at the moment. So I don't think we can say definitely it's going to be delayed by X number of weeks. We've just got to play it a week at a time. But the main thing is establishing a contact so that you can be in email or telephone contact with the centre that's going to take you on, and some guidance prenatally.
Yeah, so I think the referral, if the normal route is to refer in prenatally, then that referral should still take place, and your referral centre will manage that as they can. And the expectation is for those that are still doing prenatal counselling that will still be done, but it'll be done by phone or video. Not everywhere offers prenatal counselling. The vast majority of places do, but that referral will be managed appropriately and contact will be made. So I think every hospital has a system by which they don't lose people while they're waiting for treatment.
Thank you, Naomi. The last question that I have is, if my child is due to have a tendon transfer and this has now been postponed, is this potentially having a major impact on my child's treatment and long-term outcome? Should we limit his weight bearing and activities?
That kind of depends on what the foot looks like at the moment, and so that makes it a little bit difficult to answer. In general, tendon transfers can be done up into teenage years and still have a good effect. So, and most of us have a waiting list. So we expect most people to spend some time on the waiting list after that decision has been made anyway. Non-weight bearing wouldn't be my preferred. My preferred would be weight bearing. We want to maintain bone health and bone quality, and you can't do that if you're non-weight bearing. Denise may have some advice in terms of how that would go, but very simply from my point of view, standing on one leg always helps to keep things well balanced, and some good daily stretches would be the sort of thing we'd advise. Denise, you might want to say some more on that.
Yeah, I think it's bone health really important, but also muscle strength. So you don't want children to get weaker than they already are before tendon transfer. They're going to need their muscle strength. So in most cases, waiting for tendon transfer, you're not going to suggest your child goes for a 20-mile run, but actually doing something like Joe Wick's PE sessions, or some of there's some really good online fitness, children's fitness stuff online at the moment while you're stuck at home, and it's good to get them doing that, or some non-weight bearing exercises. And that might be that there's scope for us doing another webinar actually demonstrating some exercises you can do with your children. So that's the sort of thing that if you maybe are interested, we could look at doing in the next few weeks.
Thank you very much. Ros, do you want to look at the questions that are received?
Yeah, sure. Thanks.
Thank you.
Thanks for the questions so far. So I'll start with a couple that I received by email. So what research do we know of that talks about starting casting later on, and what does that research show?
So there's actually quite a lot of research, not from the UK, as you might expect, but from around the world, and it shows that good treatment outcomes really much later than you'd expect. So into double figures of years. Some of the when you get older, so beyond the sort of second and third year, you start to need more casting. So you start to need more casting you normally expect for a baby, but still very good outcome. And actually, just before we came online, I was just saying I've had a 2.5-year-old in clinic just recently, where everyone was going to me, this isn't going to work, this isn't going to work. And it has, and I think we need to trust in the Ponseti method. It's extremely effective. It constantly amazes me, and I think, and there is very good evidence that outcomes are still good.
Yeah, I'd like to back Naomi up with that. Having been lucky enough to spend a bit of time working in low-income countries where children have access to treatment much later, I've actually been lucky enough to sort of see the physical. See these children physically, and one child sticks in mind, a 4-year-old that I saw on my first visit to Bangladesh, and then a few years later I saw her for follow-up, and she was doing extremely well, having not had her correction till 4 years of age, and having had a complete tenotomy at sort of four years, and she had very good correction. So I think we're lucky when we can start our treatment on babies between 2 and 6 weeks of age. But, Naomi and I have both first-hand experience starting treatment later and seeing that you can still get good results.
I actually have, I do have quite a good question that just came in. Actually, where we've seen cases where they basically have gone from casting, so from 1 or 2 casts straight into boots and bars.
Okay, so that very much depends on the position of the foot. As you know, most children need a tenotomy, but if that is a child that is in the smaller percentage, in the sort of 10% or fewer that don't need a tenotomy, then that's absolutely fine. But putting a partially corrected foot into boots and bars would not be recommended.
Yeah, I'd like to, I totally agree with Naomi there. And I think one of the things about having a partially corrected foot in boots and bar is you're likely to have a very unhappy, very sore child, and that's going to lead to problems with compliance later on. It's going to a lot of stress for parents. And so unless the foot really is properly corrected, it shouldn't be going into the boots and bars.
Thank you. Apologies, Ross, back to you.
Yeah, no problem. Good question. So another question here is, are there likely to be any impacts on the child's development by starting later? For example, learning to crawl or stand? And if there are families that have had their treatment delayed, is there anything that they can be doing at home that might help their children's development in the meantime?
Okay, so I think we're always amazed what children will get walking on, and I've seen it time and time again. Some of the most extraordinary feat children will get going on, and there's no evidence that it delays them. I think you get a little bit, I mean, when you come to treatment later, you'll find that it kind of stalls it a little bit, because by the nature of what we're going to do, they're going to be in plaster and less able to mobilise at that time, but they catch it really quickly. So they join their contemporaries on that graph of improvement very quickly after we release them from plasters. So I wouldn't expect any of that. And we know that the normal walking age is wide anyway. If everything else is otherwise normal, we'd expect them to catch up with everybody else. What was the second part of the question, Ross?
It was about whether there's anything you can do to promote normal development.
So I think, yes, so we were going to suggest you can do some little manipulations yourself to keep everything flexible. That's difficult to describe in the next 7 minutes, but we're making a list of things and bits of information that we can put on both the STEPS and the Global Clubfoot and the UK Clubfoot Consensus Group website to help people. So we'll get that sorted afterwards and make sure you've got access to it.
Just to add, with my paediatric physio hat on, things like baby walkers, baby bouncers, those sort of sit-in things where you're encouraging the child to take weight through the feet, that's not really helping with development. They're better off having more time on the floor, on the mat, learning to roll, learning to sit, all the normal developmental milestones. You're not going to be improving development by using sort of baby walkers and little bouncy seats.
Right, thank you. Then another question on email here is whether all NHS trusts are following the same guidelines in delaying treatment, and this person wondering if they might go to another trust or possibly a private clinic for treatment instead. What would you advise for that situation?
I think it's very variable at the moment. There is advice about to come out, as I say, from our societies about how to manage treatment. I think it will stop everywhere. I think the danger is you'll start treatment somewhere that isn't near to you, that then has to stop, and then your treatment will be picked up later on by your initial hospital or by somebody else. And I think that would potentially just complicate the issue. We know that the Ponseti method isn't quick treatment, that it requires time and consideration, and I would be nervous about rushing into treatment when you don't know where the end point is. And I think that's really why we're advising not to start, because starting something that we can't finish is a worry to us as clinicians. And I think we know we are very confident that we can do effective treatment later on, and rather than have a stop start when you don't need to, I think having it all packaged together when everything is settled down for us feels like a better solution at the moment. Not everywhere is the same. I don't know of any private clinics still doing it. I can't help you with that. I know the private sector is largely run by doctors that work in the NHS and other clinicians that work in the NHS, and we're all being pulled back in to do other work. So I would expect those resources to fall away pretty quickly.
Yeah. And to add to that, attending a private clinic outside the NHS is not social distancing, and you have got to take into account the risk to your baby and your family of attending anywhere where you're going to be mixing with a lot of other people.
Great, thank you. So I'm aware it's 1:27. We've got a huge number of questions still that we haven't been able to answer. Just a question to the panelists, are we happy to carry on, or shall we collect all these questions up and arrange a second webinar?
I'm happy to carry on for the moment, but I still think we will have a second webinar, if that's helpful. So that both of what you said.
Yeah,
Okay.
I'm happy to carry on at the moment, but agree, second webinar definitely needed.
Okay, great. Thank you. So I've got a couple of questions about getting braces for different types of braces. So some people are asking if a parent can't get hold of anyone at the clinic or hasn't been able to get the next size up of the brace, what would you advise? And then similarly from the other side, from the brace suppliers and distributors, if parents contact them directly because they can't get anyone from the clinic, what would we advise in those situations?
I'm sorry to hear you can't get hold of anyone. That makes me worry for the centres that you're talking to a little bit, really for what's going on in their world. As I say, number one, if you think your boot is too small, then it may not be, because we are very tolerant of toes going over the end of the boot. Different boot companies have different arrangements. I'm fairly sure, I can't speak for them, but we can ask the question of some of the boot companies. We're in touch with many of them, but I'm fairly sure that if you're already in those particular boots, that the companies will arrange for that to be sent through to you and then will bill us later. So I think those arrangements were fluid, and if you really can't get hold of anybody, by all means, I'm sure the companies will help. But I don't know for sure, but we can get in touch for next week if that's an issue. Right,
thank you. So we spoke a bit about tendon transfers and what people can do if they're waiting for tendon transfers. We've had a question from someone who's waiting for a different type of surgery for a more complex case, and they're worried about the delay and possibly prolonging the treatment process. Is there anything different that you would advise for people who are waiting for other types of surgery, perhaps those more complex cases?
Other than be patient, none of us want to be in this situation. I think, for all of us, it's a process of getting used to what the new normal is. And I know many people have been on waiting lists for a long time. It's unfortunate, but everybody in the country has some reason to be anxious and upset. Nobody's on their own. I think the communities that we build up, and this is another community that we're building up of people aware of each other's problems, to support each other. But there's nothing we can do about this. Our priority, and every hospital's priority at the moment, is saving lives. And we try not to look too far ahead, because the recovery from this is going to be, I think, as challenging as being in the middle of it. And all I can do is give you my heartfelt support, and pray that we're all okay. I can't do more than that at this point. Sorry.
Thank you, Naomi. The only other thing I'd add to that is make sure that you stay in contact with the centre that you are being treated at. Make sure that you've got a current telephone number, current email, so that they can contact you. If you've got anxieties, that there is somebody that you can send those through to if they're in a position to answer. But I think making sure that your contact details are up to date is vitally important, because actually one of the interesting things we've found in the last few weeks as we're trying to set up our clinic services to be completely virtual is the number of people that have out-of-date contact details on our systems is huge. It's very easy if you change your telephone number to forget to change it with everybody. So just make sure that the centre where you're being treated has got the most up-to-date contact details, both email and telephone numbers for you.
Great advice. And we've had someone contacting us from another clinic that is doing something different. They are able to offer services outside of the hospital, so they're just asking that we let everyone know that different clinics may be in different situations. So the advice that is being given is as kind of applicable generally as possible, but for specific advice on your situation, you need to contact your own clinics to find out what they're able to offer. So another couple of questions. in a post-tenotomy cast, if the patient isn't able to come back in after their tenotomy, are we able to do a video consultation to fit the brace at home?
I think if somebody really can't come into the hospital to do that, yes, it'll be interesting. I think we'll all learn a lot if we try and do that, but there's good advice out there on how to fit the boots and how to manage them. Anything is possible, and I think it's better than, if the tenotomy is done, I think it's better than not going into the boots and bars. So yes, that would be a reasonable thing to do.
Yeah, I totally agree that we're feeling our way here, and it may be necessarily to do some virtual boot fitting appointments, but the ideal would be to have it face to face if we possibly can.
Right, thank you. Now, someone who's already in the casting phase has written in to ask if the casts have to be removed. Would we expect the feet to stay as they are or to regress? And that's a baby with arthrogryposis, but if we could answer for both scenarios.
I think with arthrogryposis, it's very difficult to know. As you know, it's a rare condition. It would be difficult to say for an individual case. In general, what we see is they have a bit of regression, but they don't go all the way back to where they were. So if your baby needed, say, imagine that we somehow knew that they were going to need 4 plasters, and you've had a couple or 3, it's unlikely you'd need another 4, but I can't say definitely, but you tend to get some improvement that stays, which is nice.
Great, thank you. I think I'm just looking through the questions here, and I think we've answered most of the ones that are specific to families. There are some more clinical questions, and I'll be guided by you, Denise and Naomi, whether we go into that or hold a separate session. There's one here about, will there be any written guidelines from our professional bodies to support decisions?
So the UK Clubfoot Consensus Group have been asked to produce something. We have done that. It has gone back to our organisations for them to have a look at it, and we expect it to come out shortly. Just mindful how inundated they are with work like this, to try and produce guidelines for every single thing. Trauma has been their priority, so the urgent conditions, quite rightly, are their priority. With the best will in the world, I can't regard clubfoot treatment as urgent, and it's interesting, we've had a comment from Spain saying they really don't, and they've stopped everything in Spain in terms of clubfoot treatment. I think our guidelines will be further down the queue from some of the other more urgent ones, but it has gone in, and I do expect them to come out.
And on the back of those recommendations, once those are approved, we will, we've put together sort of some parent statement for parents, and that hopefully will be posted on STEP's website, Loredana?
Yes, indeed. Yeah. So we will, obviously this is the first of many webinars that we're going to organize. As you know, STEPS is not just clubfoot, it's also hip dysplasia and other learning conditions. So we're working with Viscus as well to come up with further guidance and support families and individuals with learning condition as much as possible. And we're going to do it online, and we're going to launch a forum, and more guidance and videos will come out. So we're still going to be here to support, but it will be a different type of support, but still be here to help anybody in need.
Brilliant. Thank you for all the support you're providing for families. Just maybe a couple more questions then. There is one question on what PPE, that's personal protective equipment, clinicians should be wearing. And I don't know how much we can comment on that at this time. And then there's another question, whilst we're talking about casting, an atypical clubfoot who's currently on a cast holiday, would your advice be to recommence casting now or to wait? And what would be the effects of that?
Okay, in terms of PPE, I think it's difficult. I would go with your local hospital policy. We have had, which should be in line with NHS England hospital, NHSE policy. The directive is that you listen to what NHSE is saying, not anybody else, and that's the chain of command for advice around PPE. The present advice we have around plaster sores is there are differing views on that, so I'm really not going to comment. You just need to go with your policies, with your local policies. So sorry not to be helpful with that. With the complex foot, my advice would be to leave it be.
My advice, I totally agree with Naomi on that one. Leave it. Longer holiday.
Yeah.
A longer holiday. We know we can get those corrected later. Naomi and I have both had experience of treating atypical club feet a long time down the line and still getting good correction. We know that it can be done.
Yeah, I think you're likely to find yourself stuck in the middle of treatment with no benefit to anybody. Just getting more upset. Regard it as a long holiday. Plaster holiday, not a holiday.
A nice long plaster holiday. Great. And does the same protocol that we've discussed this morning, would you expect that to apply for babies with neurological conditions as well?
Yes, I would. There are some of our most complex patients, and starting complex treatment and difficult and challenging treatment at this time, I think, will frustrate everybody. Let's leave the feet in their beautiful natural state so that when we have time to come back to them, we can do that properly and without having messed anybody around.
In a way, they're even more important to wait until we can see them through their treatment properly, because they're more likely to have to come in more frequently to clinic visits, more likely to have cast slips and so have to come in for unscheduled visits. And I think that's just really impossible to manage at the moment. Certainly within London, that's impossible to manage at the moment. And again, you know, we can revisit them later.
Right, thank you. Then a question here about kinesiotaping, and I guess that could also be called strapping, or maybe you could comment on other types of cast material as well. So we've got a question here about whether that type of taping for clubfoot is effective and can it replace a cast in this situation?
So no, as we've always said, the Ponseti method is the Ponseti method. If you do it the way it should be done, that's when you get the good results. If you come away from that, that's when you end up stuck in trouble. And it's not something I would advise as a temporizing procedure, because I think potentially you're taking what could be a very easy to treat foot later on and making it far more difficult. And you're creating problems for the future with no obvious benefit that we know of. So I would steer away from it, please.
Yeah, a total agreement. Having had 32 years of clubfoot treatment experience myself, and having tried strapping, taping, different plastering methods, Ponseti method is the gold standard of treatment, and it's much easier to treat an untreated foot that is older than a foot that's had some other treatments to it. So I would not embark down alternative treatments, which still need face-to-face contacts in order to be carried out.
Thank you both. So just one final thing. I think we've covered most of the questions that are applicable to this audience. And please, Denise and Naomi, if you've noticed any that I've missed, please let's go back to those. But just to let you know, I've had a message here from CPRO Direct, who distribute the Mitchell braces in the UK and around Europe. And they are currently still open for business and are supplying hospitals around the world. So they'll be doing their best to fulfill orders and have plenty of stock. They wanted us to let you know that they have intense sanitizing measures in place for a few weeks, and that the staff who are in the office are able to socially distance. And they've also offered to drop ship orders to hospitals and orthotic clinics, and or ship directly to patients if requested to do so by the hospital. And this seems to be working well already with those who are doing it. So Thank you, CPRO Direct, for that support.
I guess the one question that I have with the boots and bars, that's the last one. Their parents are asking whether they should contact the hospital or would directly to CPRO Direct to order the boots and bar. I'm guessing it would have to still come obviously via the hospital.
I think the first port of call is the hospital, because that means that everything's lined up and we know where the new boots have gone, we know what's going on, we know what's happening. It gives us an opportunity to speak to that family as well and to find out if everything's okay. But if you really can't get in touch with us, then I don't see we're going to have a difficulty with that going through the companies. Sorry.
I think this follows on from something else that's come up as one of the questions from physio, one of the comments, to say that you should be getting in touch with your treatment centre for all of these queries. I think if you start as a family shopping around at this stage, as Naomi was saying earlier, you could end up starting treatment, not being able to complete it, having to travel long distances, which we're being advised not to do at the moment. So I think for boots and bar queries, treatment queries, neonatal queries, they need to be going to the centre where you are going to be treated. And I'd really advise parents not to shop around.
Thank you, Denise and Naomi.
Yeah,
That would say from my side.
thank you so much. Any final comments, Naomi?
No, well, I hope we've allayed some anxiety around delay in treatment. It's not ideal, but if when all this is over, we get some beautiful, slightly older baby feet to treat, the most likely thing is, as it always is with clubfoot, that we'll be able to treat them well, and that the outcome will be good. But let's keep it simple, keep those feet pink and beautiful, and when we can get back to them, we'll do that, and make sure you get the best treatment you can.
Thank you.
Any final comments from you, Denise?
I think, you know, along with what Naomi said, this is not what any of us would choose. We're not in a position that any of us would choose, but the general rule is it is better to treat a foot that hasn't been touched before than, and we know that we can get good correction. There's good evidence out there. There's a lot of people in the UK with considerable Ponseti experience that will be able to get your baby's feet into a good position if you wait.
Yeah, so and just to reassure you on that, the consensus group is planning to get together again in a few weeks' time to talk about how we're going to manage the recovery. So we can't quite see our way through to that at the moment, because we're all practicing orthopaedic surgeons as well, who have other demands on our time. But we will get together again, and we will come out with something for hopefully that can apply to large swathes of the UK to enable us to ensure that you all get the treatment that you need.
Thank you so much. Sorry to throw one last question in there, but
She always does that.
Quite a relevant one, and it's only just come in. So final question. Someone is asking someone is saying they've been advised to do stretching of the feet at home, following some guidelines. And their question is, does frequent stretching cause any harm or cause problems for future treatment?
So I think it's difficult to say. I think what we will do is try and get you some advice on how to do the stretching out there afterwards. I guess I'm not quite clear on what you mean by frequent. So when we teach families with what we call positional clubfoot to do some stretching and tickling, it's kind of at nappy changes, and it shouldn't be persistent and for too long a time. So it's really, it should all be within the baby still being comfortable. And I guess I kind of don't want people to get too fixated with this at the moment. You know, in as much as we're reassuring you that we'll get to you, that lots of manipulation we wouldn't feel is necessary. I think, you know, to a certain point it's nice to know that you're doing something helpful, but actually, you know, just enjoying time with your baby and your family is a better idea than concentrating on their feet. Concentrate on their faces instead, and their smiles, and take it that way instead.
Yeah, totally agree. Concentrate on enjoying your baby. It's nice to have a baby who doesn't mind having his feet and legs or her feet and legs touched, but actually spending lots and lots of time doing stretches when you're, especially if you're not sure whether you're doing the right thing. Actually, you know, babies move around a lot, their feet move around a lot. A little bit of gentle massage is probably all it needs, and nappy changes at the most.
Great, thank you. And just a comment coming in there that there is lots of anxiety amongst people, and we do understand that, and really want to be there to support with that. One person offering support is the Head to Toe Clubfoot charity. So you would be able to find them on Facebook. Another great source of support is Steps charity. So Loredana, thank you for that. And all of us who are clinicians will be wanting to support you as much as possible as well. So yeah, we're all in this together. And final comment from me is that today's session has focused quite specifically on the UK setting, and if you're joining us internationally, thank you so much for joining, and Global Clubfoot Initiative will be looking to provide more opportunities for discussion on how we manage this in other countries as well. So do keep in touch with what you're doing as well there. But we're going to end this webinar for today. So thank you so much, panelists. You've been brilliant. Naomi and Denise, thank you for all your wisdom and advice. Thank you, Loredana from Steps, for all the support that you're providing to families. And thank you to everyone who's joined us today. As we say, we'll see what we need to do in terms of follow-up, and we'll end this webinar for now. So thank you all for coming.
Thank you.
Bye.
Bye-bye. Bye.